The first thing, like you miss the period. That is the first thing. The second very important thing is, as soon as you miss period on a day 5 to day 8, you should not wait more than that. If you have an unprotected contact, you should straight away go for an urine pregnancy test. Nowadays we have so many tests available in the market. You can pick up any one. You can get done a morning sample. You take a morning urine sample and you get done your test. So there also, many females, they send me photograph, doctor, we are not understanding if it is positive, if it's not a negative. So the thing is, the color of first line and the second line should match. Sometimes there is artifact, sometimes there is an error, you get a black line or purple line. So that those lines are negative mostly, so don't get confused with it. Both the color, even the control and the test color, should match. This is the first thing you should know that you're pregnant. The symptoms starts quite later. The first thing comes is the beta hCG hormone. If it's positive, your urine pregnancy test is positive, then you approach a gynec. Now, why is it so? Because we don't know how to take care of pregnancy. Like first trimester, we divide pregnancy in 3 trimesters: first, second, and third, each having 3 months span. So the thing is, first trimester, there are very high chances of abortion. You don't know how to take care of yourself because it's a new thing for you and your body. So first thing, get done a pregnancy test and then approach a gynec. Don't wait for like, I'm having nausea, I'm not having nausea, I'm not having vomiting, so am I pregnant or I'm not pregnant? No. You have a test in your hand. If it's positive, come to a gynec. There are some alarming signs which you should not ignore during pregnancy, especially the first 3 months. Yeah, later also those are there, but by the time you get adapted to that thing. So the first trimester, if you have spotting or sudden cramps or lower backache, or you have some discharge, you feel uncomfortable, you should definitely approach a doctor. Bleeding, spotting, like most of the female, they think, I got the bleeding now, it's a midnight, now I'll go in the morning. No, you should not do that. The moment you think there is bleeding, there is spotting, or you have a lower back ache or severe cramps, you should approach a doctor. The major factors which will affect your pregnancy, which will affect your baby and the pregnancy outcome, that's the delivery, mode of delivery. It depends on few are like star things. The first thing is thyroid. You should not ignore thyroid. You should always have a check on your thyroid hormones. Second thing, your blood pressure. Your blood pressure, you should have. Now we have BP apparatus easily available, so get a digital BP apparatus at your home. Keep a check on your blood pressure every day. You just, on a routine basis, you keep a check on your BP. The moment you feel your blood pressure fluctuating, if it's going high or low, you should approach a doctor. Second, you have a family history of diabetes, your father or mother, anyone among like first line relatives are having any diabetes condition, you should always keep a check on your sugar levels. So try to have a normal diet. The only thing, the diet, what you have to do change is every 2 hours, you just break the fasting, right? You just break it, cut it down, go in the kitchen, you eat something like a bite or so, and it's done. Right? You don't have to add the laddus, you don't have to add the ghees and butter in your diet, right? No extra calories are needed. It will just add on to your weight, and fat is not good, right? So if you gain a lot of weight like during your second and third trimester, you'll definitely land up with diabetes. In the last trimester, you'll definitely land up with a high blood pressure during delivery. And this is the thing you should keep a check on, right? The other things, especially the hypertension and diabetes, and thyroid, because in these three conditions will definitely affect your baby. Rest of them, no. Vomitings happens because of the hormone imbalance which is occurring in your body. The excess of like beta hCG, like beta human chorionic gonadotropin, which has been secreted by the placenta. So that hormone It gives you the nausea feeling. It like see it's just the hormone. What it does is it increases your smell. Like the olfactory senses are on a high, and you don't feel taste of anything. Like your tongue becomes blunt. So for everything you feel, oh, it's smelly. And for every, like, even if you take the vada paos and if you take the charts, still you don't feel the taste because your tongue has gone blank. And this is what beta hcg does, right? So oh, this nausea and vomiting, the like misconception people are having, okay, it's related to food. No, it's related to smell, right? So for like it's an advice for every pregnant female, like try to find your smell which makes you feel better. Like some females they feel better with lavender, some females they feel good with a citrus. So you always carry your smell with you in your purse. Second important thing is tiredness, right? Your immunity goes down in pregnancy. And so try not to work and take rest as much as possible because your body's focus is entirely on your uterus, like in developing a baby. So the tiredness, your senses go down and you feel to puke. You feel imbalanced. You tend to puke. This is what it gives you the proper nausea and vomiting in pregnancy. So you should avoid these things. Like don't exert much, take rest for first 3 months. You should sleep as much as possible. You should give the time for the baby to like develop properly. So take some rest. Like I always say, president, which is your brain, prime minister, your heart. When the president, prime minister, they go to sleep, then the blood supply diverts to the uterus. Ideally, I don't allow my patients to travel for first 3 months. The reason behind that is first 3 months, it's a very crucial time. As I told you previously also, okay, abortion chances are very high in first trimester. So you don't know like how your body is going to react. Your baby is a new thing to your body. So there is a lot of ups and downs going on in your body. A lot of tornado is there. Body is unable to like what is this, and it reacts in a way like you feel very dizzy, you feel sleepy, you have nausea, you have vomitings, you have plenty of things going on. So in that you cannot travel. The important thing is that already you are in a nausea and vomiting state, and again you will travel. So again the motion sickness, and plus wherever you are traveling, we don't know whether you are going to get a medical help there. You might land up with dehydration, with severe vomitings. You might like vomiting increases the abdominal pressure. You might land up with a bleeding or spotting and then inevitable abortion. So it's like a chain of series. Like it comes in a step by step. It goes on, and then you cannot stop it. So better you don't travel. You unless and until you like cross the first lab of like first genetic screening, which is at around 11 to 13.6 weeks. You get a NT scan done, you get a genetic screening done. Once your baby is fixed, then you can travel. And the safest time to travel in pregnancy is second trimester, like 4 to 7 months you can travel. Again, the last 7, 8, 9 months we don't allow traveling because that time again your belly is big. You have a baby, you have a water bag, you have a placenta, so many things, and then your center of gravity shifts. And then in that case, how can you travel? There are chances your water bag might burst. You might land up with a premature labor. So we don't allow. Like you stay home and enjoy your pregnancy. That is what I always suggest. So the reasons for back pain, first, you should understand as your pelvis is preparing itself for the baby to accumulate, right? Because the baby grows to the size of at least like a 3 kgs. So for that space, your pelvic should adjust. There is some adjustment. There is some laxation of the ligaments. So it takes some time to get relaxed, and because of that ligament stretching and relaxing pain, you feel you have backache. You should take medicines for that? No. You should not take medicines for that. Medicines won't relieve it, because even if you take the medicine, it's going to happen. It's a natural process and it should happen. Then what you should do is few lifestyle changes, like correct your posture as your center of gravity shifts during pregnancy. So have a proper back support. Try to sit straight, right? You should always have a support while sitting, right? This is one thing. Second, you can apply like a hot and cold therapy you can do. Sometimes some females, they feel better with the ice pack, some feels good with a heating pad. This is just a diversion of pain, right? Application of the ointments or gels or hot pad or cool pad, like it's just a diversion. So do that. As once your pregnancy is done, you will be fine, right? Second, this is just like some changes. Second thing, you should have a high vitamin D3 supplements. You should have vitamin B12 supplements. If you're not eating, like if you're a vegan, then you should definitely have vitamin B12 supplements. Vitamin D3 is important, so try to have milk with protein in your diet. Protein intake helps in maintaining good health of your muscles and ligaments. Okay, so you should have a high protein diet. You should have a B12 and D3 supplements and proper posture with a hot cold therapy or application of some local ointments can help. First thing is swelling is normal in pregnancy, but only if it is limited to your feet ankle. If it's going up, like it's knee up to knee or above knee, like we grade the edema. If it goes up, if it's there on your face, then you should approach a doctor. Now, why is it so? Like first thing, why normal swelling is there? It is because of the baby's pressure. See, you have so much of weight in your belly. So it presses your femorals, like it presses your veins, and then there is a stagnation or collection of fluid in your feet, and you get edema, which is normal. And this edema is especially in the last trimester, right? Second thing, the edema or the swelling, which is there, like if it is going up, if it is above the level of knee, or you have a facial puffiness, or you feel your sleeves are tight, and this is abnormal swelling, right? So abnormal swelling correction is not possible unless and until you are taking a proper doctor's advice. Doctor checks your blood pressure, he gives you a proper protein diet. This is all if it is pathological, like if it is abnormal. For normal swelling in feet and your ankles, for that you can just do leg rising, like while sleeping you just uplift your feet, you keep two pillows below your feet, and that will help. Second thing, you should always find your side. Like most of them, they say you should sleep on the left side, but no, I feel comfortable sleeping on the right side, I'll sleep on the right side, right? So always like avoid sleeping on your back. The more you sleep on your back, your veins will get congested and the swelling will increase. You will feel uncomfortable. The for first 3 months the diet is different. Second, the half, like the second trimester diet is different, and last trimester diet is different. Why is it so? Like see, in first trimester your uterus is very small, right? In first trimester it hardly goes up to a tennis ball size, right? So in that case, what happens? Your uterus is in the middle of a bladder, which is in front, and a colon, which is in the back. So it's constantly giving you the symptoms of frequent urination and constipation, where you have bloating, you have gases, you have acidity. It is all because of your uterus is creating a pressure, right? So in that case, what you should have is you should avoid acidic food. You should avoid the foods which are giving you bloating. You should have a high fiber diet. High fiber diet includes the veggies and fruits. And most important thing is you should hydrate yourself. And 3 stars, I always say 3 stars you should follow: a high fiber diet, good hydration, and low salt diet. Low salt diet is very important because salt is a culprit for everything, right? In my experience, in so many years of practice, I have this experience. Like salt, it does what? It increases your blood pressure, It reduces the blood flow to the babies, right? By constricting the small capillaries, it doesn't allow the blood to flow very nicely and smoothly. So salt is must. You should restrict salt. Restricting salt doesn't mean ki I'm using now 1 teaspoon, so I'll use a half teaspoon. No. Salt restriction or low salt means what? You should actually use low sodium salt. Like the content of sodium should low. It helps with you'll be energetic, right? You won't have any renal complaints. Your blood supply to your baby will be good. So these three things in a pregnancy, for a pregnant woman, she should include in a diet is high fiber diet, low sodium salt diet, and hydration. This must. And no acidic food in first trimester. Second trimester is the healthiest period where you can have entirely like whatever you want you can have in second trimester. Again, last trimester, the baby grows up, it increases the pressure on your diaphragm, and most of the female they come to me in the last trimester and they say, "Madam, we have like difficulty in swallowing. We call it dysphagia. We have like we don't feel like to eat anything. We feel something has stuck over here." Right? So this is because your baby has grown up. It is putting a pressure on your diaphragm. So that time, what you should have a soft diet. You should have a very like thin diet, easy to digest, and again fibers.